HighBridge, a division of Recorded Books, presents Diabetes A to Z, What You Need to Know About Diabetes, Simply Put, by the American Diabetes Association. Read by Timothy Andrés Pabon. The suggestions and information contained in this publication are generally consistent with the standards of medical care in diabetes and other policies of the American Diabetes Association, but they do not represent the policy or position of the association or any of its boards or committees. Reasonable steps have been taken to ensure the accuracy of the information presented. However, the American Diabetes Association cannot ensure the safety or efficacy of any product or service described in this publication. Individuals are advised to consult a physician or other appropriate healthcare professional before undertaking any diet or exercise program or taking any medication referred to in this publication. Professionals must use and apply their own professional judgment, experience, and training, and should not rely solely on the information contained in this publication before prescribing any diet, exercise, or medication. The American Diabetes Association, its officers, directors, employees, volunteers, and members, assumes no responsibility or liability for personal or other injury, loss, or damage that may result from the suggestions or information in this publication. A1C test. Hemoglobin is a protein inside red blood cells. Hemoglobin carries oxygen from the lungs to all the cells of the body. Like other proteins, hemoglobin can join with sugars such as glucose. When this happens, it becomes glycated hemoglobin, referred to as A1C, or glycohemoglobin, or sometimes as HbA1c. The more glucose there is in the blood, the more hemoglobin will join with it. Once joined, hemoglobin and glucose stay that way for the life of the red blood cell, about 4 months. The A1C test measures the amount of glycohemoglobin in your red blood cells. The A1C test is usually done by a lab. A sample of your blood is taken. The blood can be taken at any time of the day. It does not matter what food you last ate. It does not matter what your blood glucose level is at the time of the test. What the A1C test can do. Tell you about your average blood glucose level for the past 2 to 3 months. You can then see how your blood glucose control has been. An A1C less than 7% is good for most people, while an A1C greater than 9% is considered very poor control. Some reports will now give the A1C value expressed as a percent, together with an average blood glucose value in milligrams per deciliter. This is known as your estimated average glucose, EAG. Allow you to compare the A1C test results with blood glucose checks you do yourself or tests your doctor has done. If the tests do not agree, you may need to change the way or the times you check your glucose levels at home. Help you judge whether your diabetes care plan is working. If your glycohemoglobin indicates that your blood glucose level was high during the past 2 to 3 months, something in your plan may need to be changed. Show you how a change in your plan has affected your diabetes. Perhaps you started to exercise more. An A1C test can confirm the good effects exercise has had on your blood glucose control. When to get an A1C test. An A1C test is typically used to diagnose diabetes. If your A1C is greater than or equal to 6% at the time of the test, you will be diagnosed with diabetes. After that, have the test done at least 2 to 4 times a year. Why you should continue self-checks. The A1C test can't replace the checks you do each day to measure the level of glucose in your blood. See blood glucose self-checks. Self-checks help you decide how to treat diabetes at that moment. What you do to keep daily blood glucose levels in range will show up in your A1C test results. Activity. Activity is good for everyone, especially people with diabetes. Activity helps your insulin, whether made by your pancreas or taken by injections, work better, which means you may need less insulin or fewer diabetes pills to control your diabetes. Moderate activity lowers your risk of heart disease and may have beneficial effects on blood pressure and cholesterol levels. It may also reduce your risk for colon cancer. It can reduce your body fat and help you lose weight. Activity keeps your joints, muscles, and bones healthy and strong. It improves balance and agility and lowers your risk of falling. Activity can also increase your energy, relieve feelings of depression, anxiety, and stress, and improve your mood. In short, activity could help you have a longer, happier, healthier life. So go ahead, get up and move whenever you can. When you are active and moving, you use 2 to 3 times more energy than when you are inactive. Be sure to check with your healthcare provider before increasing your level of physical activity. If you have not been active lately, you may need to start with just 5 to 10 minutes of an activity and work up to longer or harder activity sessions. It is also important to understand that increasing exercise and activity may reduce blood sugar levels. For people on insulin or medications that lower blood sugar, increasing exercise may increase your risk for low blood sugars for 24 or more hours after exercising. Please talk with your healthcare provider about how to increase your activity safely. Some ways to get moving. Get up to change TV channels instead of using the remote. Do the ironing while watching TV. Vacuum the living room. March in place while watching TV or walk around your house during commercials. Wash dishes, load the dishwasher, or load the washer or dryer during commercials. Mop the kitchen floor. Sweep your sidewalk. Wash and wax your car. Use a rake instead of a leaf blower. Use a push lawnmower instead of an electric one. Plant and maintain an herb or vegetable garden. Take your pet for a walk. Push your baby in a stroller. Play actively with children. Volunteer to work for a school, hospital, or local park. Walk to the subway or bus stop. Take the stairs instead of the elevator or escalator. Stand or walk around while you're on the phone. Walk during lunch, during your break, or while waiting for an appointment. Do a few minutes of extra walking when you go grocery shopping or to a mall. Park your car farther away from your destination. Take a walk with someone you want to talk with. Alcohol. 1 or 2 drinks a day will have little effect on your blood glucose level if you have good control of your diabetes, are free of complications, and drink the alcohol close to or with a meal. However, drinking 2 or more drinks on an empty stomach can cause low blood glucose if you are taking certain diabetes pills or insulin, or if you were just exercising or about to exercise. Alcohol and low blood glucose. Insulin lowers your blood glucose. Certain diabetes pills, sulfonylureas, and meglitinides make your body release more insulin to lower blood glucose. Exercise makes your insulin work better at lowering blood glucose. Usually, if your blood glucose drops too low, the liver puts more glucose into the blood. The liver has its own supply of glucose, called glycogen. But when alcohol, a toxin, is in the body, the liver wants to get rid of it first. While the liver is taking care of the alcohol, it may let blood glucose drop to dangerous levels. If you have low blood glucose after you drink, people might smell the alcohol and think you are drunk. The signs are the same. Tell them you have low blood glucose. Tell them what they need to do to help you take care of it. Wear a medical ID bracelet stating that you have diabetes. This will help in case you can't talk. If you drink and then drive when you have low blood glucose, you may be pulled over for drunk driving. You may even have an accident. When you drink even a small amount, let someone else drive. Pick a responsible person ahead of time. How to avoid low blood glucose. Always eat something with carbohydrate when you drink alcohol. Check your blood glucose before, during, and after drinking. Alcohol can lower blood glucose as long as 8 to 12 hours after your last drink. Follow the Dietary Guidelines for Americans recommendation of no more than 2 drinks per day for men and no more than 1 drink per day for women. A drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. Alcohol and complications. Alcohol can worsen nerve damage, high blood pressure, and high blood fats. If you have any of these problems, ask your healthcare provider how much alcohol, if any, is safe for you to drink. Alcohol in your meal plan. Work with a dietitian to include your favorite drink in your meal plan. Be aware that regular beer, sweet wines, and wine coolers will raise your blood glucose more than light beer, dry wines, and liquors, such as vodka, gin, and whiskey, because they contain more carbohydrate. Carbohydrate is the main nutrient that raises blood glucose. If you are watching your weight, be aware that alcoholic drinks can have anywhere from 60 to 300 calories each. Just cutting down on the number of drinks or changing the type of drink can help with weight loss. How to cut calories. Use 80 proof in place of 100 proof alcohol. The lower the proof number, the less alcohol in the liquor. Each gram of alcohol has 7 calories. Put less liquor in your drink. Use no-calorie mixers such as diet soda, club soda, or water. Choose light beer over regular beer. Choose dry wine over sweet or fruity wines and wine coolers. Try a wine spritzer made with a small amount of wine and a lot of club soda. Cooking with alcohol. When alcohol is heated for cooking, either on top of the stove or in the oven, some of it evaporates. How much of it evaporates depends on how long you cook it. If you cook it for 30 minutes or less, about 1/3 of the alcohol calories will remain. You'll need to count them in your meal plan. If you use alcohol regularly, 3 times a week in your cooking, the calories can add up. Blood glucose. The foods you eat are broken down into glucose by your body. Glucose is a form of carbohydrate or sugar. Glucose travels through your blood to your cells. Cells use glucose for energy. To get inside your cells, glucose needs the help of insulin. In people with diabetes, there is a problem with the insulin. Sometimes there is no insulin, see type 1 diabetes. Other times, insulin is present, but the levels are not adequate and the body has trouble using it, see type 2 diabetes. When insulin is not able to do its job, glucose cannot get into the cells. Instead, glucose collects in the blood. The amount of glucose in your blood is called your blood glucose level. It is usually measured and reported as milligrams per deciliter or as millimoles per liter. Too much glucose in the blood is called hyperglycemia or high blood glucose. Too little glucose in the blood is called hypoglycemia or low blood glucose. Blood glucose levels that are too high or too low may make you feel ill and harm your body. See blood glucose high, blood glucose low. To feel good and stay healthy, try to avoid high or low blood glucose levels and aim for a blood glucose range your doctor or diabetes educator advises. And keeping your blood glucose in range and avoiding the highs and lows takes some effort. You can do it by balancing food, activity, and diabetes medicines or insulin. One of your best tools is a blood glucose meter. Some tips for success are: food. Follow your meal plan. See meal planning. Include snacks in your meal plan if your diabetes care provider or dietitian recommends it. Try to eat 3 meals each day that are spaced at least 4 hours apart. Don't skip or delay meals or snacks. If you vary the amount of food you eat from day to day, it is important to discuss this with your healthcare team, as the doses of some medications or insulin may need to be adjusted. If you take insulin, ask your diabetes care provider how to adjust your dose when you want to eat more or less than usual. Activity. Follow your exercise program. If you take insulin or certain diabetes pills, the sulfonylureas, the meglitinides, and if you are going to exercise for more than 1 hour, you may need to eat snacks to prevent your blood glucose from dropping too low. Examples of snacks are a piece of fruit, half a cup of juice, half a bagel, or a small roll. Talk with a dietitian or diabetes educator about how much and when to eat. Be sure to check your blood glucose levels after exercise. Exercise may lower blood glucose for as long as 10 to 24 hours afterward. Some people can experience an elevation in their blood glucose levels immediately following exercise. This can occur as a result of an intense exercise program or as a result of decreasing the dose of medication too much prior to exercise. Your doctor can assist you in how to adjust your medications for exercise in these situations. If you take insulin, ask your diabetes care provider if you need to adjust your dose for exercise. Continuous glucose monitors, CGMs. In addition to blood glucose meters that can be used to check blood glucose levels several times a day, there are now devices called continuous glucose monitoring devices, CGMs, that can be used by some people with diabetes that can provide information about their blood glucose levels at all times. These devices require the insertion of a sensing device under the skin that sends information about circulating glucose levels to a device that displays the result. The sensor transmits the results to the device every 1 to 5 minutes, depending on the brand. This is beneficial because you will know what your blood glucose is at all times, so you can better adjust your treatment plan. Check with your insurance provider to see whether a specific device is covered before you start shopping around. Insurance coverage is the reason why continuous glucose monitors aren't for everyone, and they don't replace regular blood glucose testing. Many insurance plans still don't cover CGMs for people with type 2 diabetes, so it's important to find out beforehand if you are covered. Diabetes medicines or insulin. There are 3 types of medications for treating people with diabetes: pills, insulin, and non-insulin injectables. Pills can be used to treat people with type 2 diabetes. Insulin is absolutely essential for the treatment of type 1 diabetes, but is also necessary to help control blood glucose levels in many people with type 2 diabetes. There are 2 types of non-insulin injectable medications available. Pramlintide can be used in combination with insulin by people with type 1 and type 2 diabetes. Incretins can be used by people with type 2 diabetes to help control blood glucose levels. Incretins require that insulin-producing cells are present in order to work. Take insulin or diabetes medicines as your doctor has directed. Talk with your doctor about changing your insulin or diabetes medicines if your blood glucose levels are not in the range that has been recommended. Perhaps a different dose, type of insulin, or combination of medicines would work better for you. If you take insulin, ask your diabetes care provider about the best places on your body to inject it. Some people find that taking their insulin in the same area at the same time of day keeps blood glucose steadier. Consider an insulin pump. Pumps imitate the natural release of insulin better than injections do. See insulin pumps. Checking blood glucose. Check your blood glucose as often as recommended by your diabetes team. Your doctor will tell you how often you should check your blood glucose levels. People who take insulin more than twice a day usually need to check their blood glucose at least 4 times a day. If you check only once a day, it is usually advisable to vary the time you check so you and your doctor can see what your blood glucose level is during the day as well as the morning. Check your blood glucose more often if you do not feel well and are not certain if your blood glucose level is low or high. You ate too much or too little food or tried a new food. You delayed or skipped a meal or snack. You are sick. You are under stress. You did not take your insulin or diabetes medicines. You took too much insulin. You took too many diabetes medicines. You did not do your usual exercise. You exercised harder or longer than usual. Blood glucose high. Too much glucose in the blood is called hyperglycemia, or high blood glucose. High blood glucose is one of the signs of diabetes. Over time, high blood glucose can damage your eyes, kidneys, heart, nerves, and blood vessels. Causes of high blood glucose. You ate too much food. You ate too much carbohydrate. You took too little insulin. You did not take your insulin. You didn't take the proper dosage of your diabetes medicine. You did not take your diabetes medicines. You are sick. You feel stressed. You skipped your usual exercise or activity. High blood glucose is harder to sense than low blood glucose. If your glucose is very high, you may feel some of the following signs. Signs of high blood glucose: headache, blurry vision, thirst, hunger, upset stomach, frequent urination, dry, itchy skin. You may not be able to tell that your glucose is too high by these signs alone. The only sure way to know is to check your blood glucose. See blood glucose self-checks. Your glucose reading will help you decide what to do. How to treat high blood glucose. If your blood glucose is above your target range, or between 180 and 250 milligrams per deciliter, 1. Do as your doctor has advised you. You may have been told to try one of the following: a small extra dose of short-acting insulin, a smaller upcoming meal or snack. 2. Check your blood glucose again after 1 to 2 hours. If your blood glucose stays above 250 milligrams per deciliter, check for signs of diabetic ketoacidosis. See urine ketone test. If you have any of the signs, call your doctor right away. If your blood glucose stays above 350 milligrams per deciliter, call your doctor. If your blood glucose stays above 500 milligrams per deciliter, call your doctor and have someone take you to a hospital emergency room right away. Blood glucose low. Too little glucose in the blood is called hypoglycemia, or low blood glucose. Low blood glucose may occur if you use insulin or take certain diabetes medicines, sulfonylureas or meglitinides. If not treated, low blood glucose can make you pass out. At worst, low blood glucose may cause seizures, coma, and even death. Causes of low blood glucose. You ate too little food. You ate too few carbohydrates. You delayed a meal or snack. You skipped a meal or snack. You exercised harder or longer than usual. You were more active than usual. You took too much insulin or too many diabetes medicines. You drank alcohol on an empty stomach. Warning signs of low blood glucose. There are many warning signs of low blood glucose. Your own signs may be different from what someone else feels. Learn your early warning signs of low blood glucose. Share your signs with someone who can help you notice them. You may also have blurry vision, a dry mouth, a headache, or a pounding heart. When any of your warning signs occur, you need to treat low blood glucose right away. This is especially true if your blood glucose has been high for a long time and will go away as your body gets used to better glucose control. Some people may get symptoms of low blood glucose with any blood glucose below 100 milligrams per deciliter. People whose blood glucose has been running high for an extended period of time may feel hypoglycemic when their levels drop into a healthy range, which could be in the 80s or 90s. It's important to get used to what normal feels like. If your blood glucose is below your target range, or less than 70 milligrams per deciliter, it's best to take a glucose-raising snack. However, it is important to avoid overeating, as this can result in a high blood glucose level. Some people may not feel symptoms even when their blood glucose is very low. This is called hypoglycemia unawareness. If this happens to you, your doctor may ask you to check your blood glucose levels more often to identify what causes the low blood glucose episodes and try to avoid these, and to have you ask those who are close to you to inform you if you are behaving in a way that may be caused by a low blood glucose level. For example, talking very slowly. Warning signs. Your signs may not be on this list. Angry, anxious, clammy, clumsy, confused, hungry, impatient, irritable, lightheaded, nervous, numb, pale, sad, shaky, sick to stomach, sleepy, stubborn, sweaty, tense, tired, weak. How to treat yourself for low blood glucose. 1. Check your blood glucose with a meter if you can. See blood glucose self-checks. If your blood glucose is under 70 milligrams per deciliter, go to steps 2 and 3. If you can't check, go to steps 2 and 4. 2. Eat or drink something with about 15 grams, half an ounce, of carbohydrate. 3. Wait 15 to 20 minutes, then check again. If your blood glucose is still below 70 milligrams per deciliter, repeat steps 2 and 3. If you have repeated steps 2 and 3 and your blood glucose is still below 70 milligrams per deciliter, call your doctor or have someone take you to a hospital emergency room. You may need help to treat your low blood glucose, or something else may be causing the signs. If your blood glucose is 70 milligrams per deciliter or above, stop drinking and or eating foods listed in the table. You may still feel the signs of low blood glucose even after your blood glucose is back up. Go to step 4. 4. If your next meal is more than an hour away, eat a small snack of carbohydrate and protein. Try a slice of bread with reduced fat peanut butter or 6 crackers with low-fat cheese. Treat low blood glucose with one of these foods: glucose tablets or gel, dose is printed on the package; 1/3 cup, 4 ounces of fruit juice; 1/3 can, 4 ounces of a regular, not sugar-free, soft drink; 1 cup, 8 ounces of fat-free milk; 2 tablespoons of raisins, 40 to 50; 3 regular graham crackers; 1 tablespoon of granulated sugar; 6 saltine crackers; 1 tablespoon of honey or syrup. Having someone else treat your low blood glucose. Sometimes you may need someone to help you treat your low blood glucose level. Maybe you did not notice your signs, or maybe low blood glucose has made you too confused to treat yourself. Whatever the reason, teach someone else ahead of time to do it. Keep foods to treat low blood glucose near you at all times. Place a small box of juice in your desk drawer at work or at school. Put glucose tablets or gel in your purse or coat pocket and in the glove compartment of your car. Tell others where you keep them. If you take insulin, get a glucagon emergency kit. Your doctor can prescribe one. Glucagon is a hormone that is made in the pancreas. Glucagon makes the liver release glucose into the blood. A glucagon kit comes with a syringe of glucagon and instructions on how to use it. Keep the kit with you. Tell family, friends, and coworkers where you keep it. You or a member of your healthcare team can teach them how to use it. If you can swallow, 1. Have someone get you to eat or drink something with carbohydrate, sugar in it. If you cannot swallow or if you pass out, 1. Have someone inject you with glucagon in the front of the thigh or the shoulder muscle. 2. Have
Sample complete. Ready to continue?